with the waivers and flexibilities that are being offered with VDH. So once I receive that documentation from her, I can forward that information to you. So it's already 10:02. I'm just going to, I'm sharing my screen with the agenda, and I have her listed first, so we'll let her speak first, and then we can move on to any updates, resources, and just kind of have an open forum to check in with some program updates to see how everyone is doing.
I see it. You got that white something right on your eyes.
So I will ask that if you don't mind, can you please ensure that you are muted? And Conchetta, I will pass it over to you. Is she still on? Conchetta, you might need to unmute yourself. You were working fine previously if you are speaking currently.
Can you hear me now?
Yes, we can hear
Oh,
you.
right. I told you no matter how many times I practice this, I always tend to mess it up.
No
Okay,
problem.
let's start again. Thank you so much, Ms. Jeffries, and everybody from Head Start for inviting me on this call. I am so excited that this collaboration is happening. And I am available not only this Friday, I am on a little bit of a tight window this Friday, but any future Friday, anytime. It doesn't even have to be during a call like this. Like Ms. Jeffries said, I have answered the questions. I've provided specific email links, email addresses, resources that I've typed up that I'm going to shoot her way after this meeting that she can share with y'all. And instead of getting the, if you have additional questions, instead of getting the, well, call the help desk or call your specialist, I'm going to give you my direct line and my direct email so we can work together on this, because we value, VDH values Head Start participation more than you would ever know. It's a fantastic program, and we want to keep as many of y'all in the CACFT as possible. So I guess the best way to start, unless somebody has a different approach, is I got about 4 or 5 questions that I'm just going to go through and answer. And then if anything comes up, please stop me in the middle, stop me anytime, and feel free to ask. So the first question was, what are the current CACFT flexibilities provided in Virginia for Head Start programs offering varied service options of instruction, meaning virtual, remote, or hybrid? Fabulous question. There are lots of flexibilities. So what I did is I provided the CHAMPS. I know most of you, if not all of you, have CHAMPS access to our online claiming application system. So if you go on to CHAMPS and you log in and you choose the CACFT program, and then you click on applications, you don't have to write any of this down because I have it all typed up for you. Applications and download forms, you're going to see the most current waivers that USDA has given to the CACFP. I think at one point, I can't even tell you which month it is, honestly, but like a couple months ago, they had extensions 5, 6, 7, 8, but everything that's up on the website is current. Another avenue to view the most current flexibilities is to go directly to the USDA FMS website. And I also have that link, and it's a little tricky. When you scroll down, it's just fns.usda.gov/CACFP, or you can just Google USDA CACFP. When you scroll down, it's going to ask you, it's going to say, I am a state agency, I am a provider, or I'm a home. Click on state agency because you get the most information. You don't want to click on provider because they're only going to provide you with provider information. Click on state agency so you get it all. And underneath that, there's a subheading called Managing the CACFP. Click on Policy Memos. And that's where you're going to see all your updated waivers. So this answer kind of goes into question number 3. Do the CACFP flexibilities allow for providing snacks to families receiving virtual remote instruction? The answer is absolutely yes. Absolutely, without a doubt. And not just snacks, but also meals. And let me tell you about the 4. So again, we have like 26 waivers. USDA for the first time, I hope no one from USDA is on this call. For the first time ever, we're just cranking out these waivers. We couldn't keep up with them. But the 4 that apply specifically to meal service and CACFP are the nationwide waiver to allow parents and guardians to pick up meals for children, extension number 5. So parents, guardians, they can just come on by, you schedule a time, they can pick up not only snacks, but they can pick up meals. And we want that happening. Nationwide waiver to allow meal pattern flexibility, meaning you don't have to meet the CACFP meal pattern anymore. Man, I thought I was going to hear like woos and wahs on that one. But as long as you're, right? Oh, I got one. There's one. But you don't have to follow that meal pattern flexibility. And I know a lot of y'all do, whether you follow NSLP, whether you follow SFSP, whether you follow CACFP, or whether you provide what you can at the time, we're going to reimburse you. Period. The next one is the nationwide waiver to allow. I'm sorry?
Can you hold 1 second, Conchetta? Somebody is unmuted. We can hear you communicating on the call. Do you mind, please, self-muting? That would be so helpful so everyone can hear. Thank you so much. Go ahead, Conchetta. You may continue.
Thanks. I just tend to keep talking. I tend to talk a lot.
That's okay.
And the next one is a nationwide waiver to allow non-congregate feeding in the CACFP extension 2, which means you don't have to have that which I have never been a fan of. This is my personal opinion of anyway, especially with social distancing, with all the new, DOLE rules coming out, and just for, overall safety, health and safety of these children, of your staff, your team. Non-congregate feeding is off the board. So again, that plays into if a child comes into your program and then has to leave at noon for whatever reason, or has to leave at 10, feel free to give them that lunch, that snack, whatever, and count it, reimburse it. You will be reimbursed for it. And then the last one is the meal service time flexibility. And I know this applies to NSLP, SBP, and also CACFP. We are only on extension 2. I don't know if y'all are only on the extension 2, but it's the same exact. There's no time limits between meals. I think in schools you have to have certain time, lapses between serving meals. No more, gone. So the exciting part about these 4 waivers is that they've been extended through September 2021. So for the entire next fiscal year, you can operate with these 4 waivers. So that is what I was over the moon about, because USDA gets it. They understand that we might be going into a phase 2. Being at the Virginia Department of Health, we see numbers every day. Unfortunately, they're not looking all that great. I can't tell you that things are going to go back to normal. I'm not the health commissioner. I'm not a doctor. I'm not an epidemiologist. But we see the data, and we want what's most safe for, again, not only you, your students, your team. So take advantage of these waivers. So when you go on to Chance, and like I said, I'm going to send all of this information to Ms. Jeffries. There is one form, and it's don't worry, it's not a federal form. It's a form that I created to streamline you just check the boxes, which waiver you would like to apply for. I would check all of them. Even if you're not going to use all of them, in the event that one day you do, you're covered and you will be reimbursed. So that is you're hearing it from me. I would check all of them regardless if you plan to use them or not. We just ask that you keep the data because, that's what USDA is going to want at the end of the fiscal year. They're going to want to know how many parents came, how many times did you have to go a little rogue from the meal pattern? How many times did you serve non-congregate? And that's just in your attendance and meal count sheets. So if you have those and if you're able to put all that data together and shoot me a number in December, I'm happy. And that's all we need. We don't need anything more than that. Let's see. So I think I answered number 3 with number 2. I think number 4. Yes. So did CACFP provide an extension on the waivers regarding congregate meal requirements? Yes, through September 2021. All 4 of those are through September 2021. So this entire fiscal year, like I said, go on the download forms and Champs, fill out that, check all those boxes, submit it. You're just going to have to hit submit and it'll go to your specialist. We will approve it. We will not be denying it. And if you do have a problem, if for whatever reason somebody denies it, call me directly, please. I tend to respond to email a little more quickly. So if you want to email, that's even better. And I have all of that information at the bottom of this resource material. Okay, number 5. Do you have any specific updates pertaining to the pandemic EBT benefits for Head Start families? I do not. That lives with the Virginia Department of Social Services, and the woman you need to speak to, the Jedi of EBT benefits, is Claudia Jackson. She will be able to answer anything and everything that you want to know about EBT benefits. I didn't have a chance to I have her email, and I will add it to this and her phone number, so y'all don't have to look that up. Okay, next one. Are there any specific resources? Absolutely, that we can provide to Head Start programs regarding CACFP that can be utilized for reference. I have a laundry list of them, and they're all, so if you can just Google VDH CACFP, and it'll take you to the VDH website, not the CHAMPS website. Although I do have that on there as well. Like I said, you don't need to write any of this down. I have it all pre-made for you, and I'll send it to you. But there is training, and there is a resource. This really, really unique thing we did this year, because this year is like no other year we've ever experienced. And it's resources to help not only your students from all ages, but your staff, your team, resources on how to cope during this time. And I think it's very, very valuable. Even if you take, it's like any good book. You're not going to take everything from the book and make it yours, but you're going to take bits and pieces of what applies to you and your program and apply them. And I think this is a great resource for you to just kind of look over and see if there's anything you can use. And if there's anything that you want from us, please let me know, and we will do our best to get it to you. And then lastly, there's a fact sheet. We've gotten pretty big into, actually we're riding your coattails, and we've gotten pretty big into farm to CACFP. So anything, check that site out as well. We have a really cool branding, really cool activities, but you'd be shocked what you can claim, what you can use your reimbursement for that falls under farm to CACFP. So like I'm telling everyone, as if it fits in the box, claim it. We want you guys claiming as many meals as possible. On our side, as far as state agency monitoring, there will be, all right, I'm going to get woos on this one. There will be no in-person monitoring for all of fiscal year 2021. If it is time for you to have a review and you are open, we will simply ask for a desk review for information to be electronically sent to us. It's going to be extremely streamlined, and it goes the same for y'all. If you are a sponsor of multiple Head Starts, you do not have to do in-person monitoring. It's the same thing. You can ask for documentation. As far as a meal service observation, you can do it through Zoom. You can do it by having your staff send you photos of the meals. So we are trying our hardest, and we're thinking creatively to have this as easy. I mean, the pandemic in and of itself is tragic, sad. It's hard enough emotionally. We're not going to add to that. So we are trying to streamline this because we want you to stay in CACFP because we don't know what's next. And I will keep Ms. Jeffries abreast of if I hear anything, what's next. You know, if the governor, I am part of the Children's Cabinet, the subgroup. And so if I hear anything, she'll be the first to know in the event that things do change. So I think I did that in record time. I do apologize for speaking so quickly, but I do have to go pick my daughter up from school in Lynchburg because unfortunately 2 of her classmates tested positive for COVID and mom is panicking. So after I hang up with y'all, I'm going to head that way and grab her. But before I do that, I'm going to send this information sheet. And it has my phone number. It has my personal cell phone number, has my email address. And I don't sleep very well, so it doesn't matter what time you email me or call me. Chances are I will answer or email you back within record time, I promise. So that being said, are there any questions that I can answer immediately?
Conchetta, there's a question in the chat. It says, what about providing store cards for parents to buy their own meal?
I think that's a fabulous question. A store card. So the CACFP, unfortunately, is based on meals served. And that, when we say meal served, that's the reimbursement that we get. VDH acts as the pass-through. FNS is our funder. We are the pass-through that we pass through to sponsoring organizations and independent centers. We would need to see, that's why we have that oversight, that extra independent center / sponsoring organization oversight, because we need that individual saying, yes, this is true because you signed the certification statement. If we just give parents a card, we would have no idea. So it's sort of I don't know if I can pitch it to USDA. I'm not so sure they would tweak the regulations for that. However, that's another question for Claudia Jackson at BDSS, because I know that the CARES Act provides, I know that each food bank got $1 million in the CARES Act. My buddy Davis is a lobbyist at McGuire Woods, and he was able to get that into the General Assembly. And Claudia Jackson, you know, being in charge of the EBT benefits, might have some other tricks up her sleeve to where that could happen. Anything else for me? I'm on a roll, I think. Yeah, I do appreciate it though, and I told Miss Jeffries, like, I know you're gonna hang up, and I'm gonna hang up, and I'm gonna say, gosh, I wish I included that, and oh my gosh, you know, and you're gonna have questions. Like I said, anytime, call me, email me. I'm gonna shoot this document over to her, and I'm happy. I mean, if y'all don't think I speak too quickly and I make some sense, I'm happy to come back anytime for another Friday get together.
Thank you so much, Conchetta. Does anyone have any final questions before Conchetta has to leave us on our call today?
Gosh, you guys are easy. I
Well,
want to come work with y'all.
no problem. No problem. Well, thank you so much, Conchetta. I know you have something very pressing that you have to attend to. And I want to say thank you for joining us and allotting us some time to answer some specifics. I know once we receive the resource information and the specifics about the waivers, if any questions should arise, I will get in contact with you.
Absolutely. Please do not hesitate. And the pleasure has been all mine. And I really do hope to talk to y'all again soon.
Yes, thank you. I hope all is well with your daughter.
Thank
And be
you.
safe.
Yes, y'all stay safe and try to enjoy your weekend. Relax, y'all. It's well deserved. Have a good one.
Thank you. Take care.
Thank you. Bye bye.
Bye-bye. Okay, so grateful that Conchetta was able to join us and jump on and just answer some specifics. I will follow up regarding the pandemic EBT. I have not received any information, and so that's why I wanted to pose that question to her as well to see if she received any updates. All the information that I received from the Department of Social Services is that it's still being processed. So they haven't told me the specifics, if people have received anything. They haven't given me a timeline. So that was one of the questions that was on the list. I hope that wasn't a whole lot to take in. That was a lot of information, but I thought it was essential. I know that in the past, a couple of questions have come up pertaining to reimbursements from CACFP and any types of waivers. And I know there was some specific questions surrounding snacks. Should you provide snacks for parents that are participating virtually or not? And so I think she addressed all of that. So what I'm going to do, I'm going to share my screen and pull up the agenda for today. So what I shared on the agenda, the COVID-19 update, I think is essential because we know across this country, numbers are spiking in all at the very least 40 of the 50 states. So Governor Northam added just his personal thoughts, and that's what I put here, just urging people to continue to stay vigilant and to continue to following public health guidelines. So just as Conchetta just mentioned, somebody tested positive at her own child's school. We do have lives outside of the programs. And so, I want to ensure that everybody is looking after themselves, taking care of their health. And, you're responsible for other people, whether it be children or other family members, parents and such. So I just want to make sure that people are really doing all that they can to stay as safe as possible. Now, there has been some adjustments in the CDC guidelines that were just mentioned this morning. So once that information is fully flushed out, I will share that on the next agenda so that you will have what the updates and specifics are regarding that. So as far as some resources that I shared with you this week, we have Reading Stories Aloud to support transition to kindergarten. We are still operating, whether you are virtual, remote, hybrid, in person, we're still operating services. And so we still want to think about transitioning for our Head Start children to kindergarten for next year. I would like to share that Virginia has been chosen by the Office of Head Start to participate in the 100 School Reach Project. It was an addendum to the collaboration demonstration that Dr. Bergeron was working on, and that's all about kindergarten transition. So I will be in contact with some of the Head Start programs that, especially those grantees that are school divisions, so that we can put some type of transition summit together. You'll get some more information about that later on down the line as we start planning. So we're excited to have this opportunity, excited to make the connections. We'll probably align with some of the preschool development grant work that's already going on across our state and Head Start programs, because some of their strategic planning included transitioning. And so we will crosswalk that information to see how we can make those connections and align and move forward from there. So I'm excited to participate in that. I also shared with you some guidance for reopening buildings after prolonged shutdowns or reduced operation. This is from the Office of Head Start. Some buildings have been closed for an extended period of time, at the very maximum, at least since last March. And so there are some things that you need to consider as it pertains to reopening buildings, even if it's not till its full capacity. You know, there, of course, they talk about things that you've already considered when you think about the HVAC system and plumbing and air quality, things of that nature. And it gives you some specifics that you can review and look at that. The National Center for Program Management and Fiscal Operations have provided 2 resources here that I wanted to include. Digging into data for responsive programs. Even though we have a lot of flexibilities that have been put in place by the Office of Head Start, we still know that data is essential to the work that we're doing. So they give you some guidance and some resources there on how to look into the data that you are able to collect and how can you utilize that in order to advance your program operations and make those connections to be a more responsive program for your children and families. They also have a resource on how to use consultants strategically. So we did acquire some extra funding as far as from the CARES Act. And so people are utilizing that funding in various ways. And one of those ways might be to add a consultant to help with some services for children and families, whether it be through mental health or some other avenues. So they give you a guide on how to utilize those consultants most effectively. And I thought that would be beneficial to you. So, reminders, I sent out the link for the needs assessment survey last week. And so we did have some grantee agencies that have already started the needs assessment survey or have completed the needs assessment survey for the 2019-2020 data capture. And I'm just urging everyone to please go in and do your part and share your voice for the types of services that you were still able to manage to provide to children and families even through the pandemic. I shared with you previously, we did include a new section that spoke specifically so that you can kind of detail what you were able to do once we were affected by the pandemic, and how you allotted your funding when you received those emergency supplemental funds for COVID. So please ensure that you can complete that so that you can lend to the picture of the services that we offer in Virginia. Also, if I check this afternoon, if we are at less than 50%, I'm gonna stop my share. If we are at less than 50%, we will extend the deadline. I know you have a lot going on. You have to prioritize what you're doing as far as instruction, as far as keeping your programs operating. So I applaud you for that. But this data information is very important. And as I stated before, it is shared out through other state agencies once we have the final compilation. So I'll review the numbers this afternoon and I will check and see where we stand as far as participation. And I might have to give an extension, but you will be receiving communication via email to let you know if there will be an extension. So I think those programs that have already started or have already completed. But, you know, this is normally supposed to be a more informal week, but this was the only opportunity that Conchetta had that she would be able to join us. So that's why we had a guest speaker today. But I wanted to give people an opportunity to just kind of debrief and check in with everybody if they would like to share any level of program updates. I know a lot of programs are going from virtual to hybrid or back to full on in person services across our state. So, is it anyone that would like to share anything specific as far as a program update? How are they doing?
Surviving. That's about all I can say. From day to day, from hour to hour, we're surviving. We're actually open. They had a school board meeting yesterday, and I went to it not knowing what really was going to be because our numbers in Scott County has skyrocketed, and but actually they just closed one of the high schools and one of the middle schools, and so far they didn't. It's not affecting the whole county, so I guess we'll wait and see what happens in the next couple of weeks. But our numbers look terrible for our area.
And
But
I'm so
our
sorry to
kids
hear
are
that.
there, and the teachers are doing an amazing job. Our whole staff's doing an amazing job. So the kids love it. I mean, they're as different as it is. The kids love it. I was in a couple of classrooms this week, and it looks different, but they're doing it. So
Thank you so much for sharing, Kathy. And you know, we just need to have some little signs with different words on it because it depends on the day of the week, the time of the day, how you feeling, how you doing. And but I will say that surviving is an appropriate adjective to utilize for a lot of people. Did anyone else want to share out any program updates? How you doing?
I just had a question for Kathy. How are the children doing with, this is Shaiki, with wearing the mask and the social distancing? How's that been?
oh wait a minute, they have been amazing, absolutely amazing. Um, they don't pay attention to it. I guess because they've seen so many other people. They just act like it's a normal thing. You know, they come in, they do their temperature check, they do hand sanitizer before they walk. We got stations outside. They do that before they walk inside. Um, they come in with their little mask on, and it's working. I don't know. They don't pay attention to it. So uh, no, it's not. It's really not been a problem. We actually are having our 2-year-olds wear them now. So we weren't having them to, but our early head starts, the ones that are 2 and above, we've been having them wear them, and they've done great. You walk outside and you see all the little kids run around with their little mask on, and they've done great. I mean, I don't know. Some of you may have heard, but it's not been perfect. But we were doing it and staying afloat. So
I have I have some, I don't know if you'll be able to see that in
mhm.
regards to the children with the mask. This is
Mhm.
Tri-County.
Mhm.
So she has her little mask on. There's one with the computer.
Wow. Okay.
So they are really adjusting to, look at that. They are just so darling and enjoying activities together. So as for Tri-County, it has been, oh, there's one more. Look at that. We've had, it is trying, but we have been in class since September the 8th. They are doing amazingly well. Like the other lady said, the teachers are doing a fantastic job as far as coping and dealing with the different aspects, how we have to handle things now. But I'm so excited to see the children being able to get that social, emotional skills, working. They are enjoying themselves, meals together. They're enjoying that. I was able to get, Tri-County has had a issue with bus drivers. So we have, I'm excited to say that we just hired a new bus driver for Mecklenburg County, and we have one that's coming on for Halifax County. So as of the 1st of November, we will have all of our drivers in place. So it's been hard. We do have two classes that's total virtual, and on Fridays, they deliver packets to the families. So we have a bus driver that's available that will drive them, the teacher and the assistant. So they do get a chance to see those teachers um, virtually with the activities that they have via Zoom or our Facebook or Class Dojo. So on Fridays, they actually get a chance to see those parents and see the families delivering all of the packets for them. And actually, we're excited about the response of the parents. They're sending these activities and taking pictures and letting the teachers know that they're doing these activities. Some of them are even doing videos and showing the videos to us. Our family advocates have gathered over um, 90 some pumpkins. So they have an activity. All of those pumpkins has been delivered to every family so that they can do a mail enrollment. This is for our mail enrollment piece. They will carve the pumpkins, decorate them however they see fit, take pictures and send them to us. So we're excited. We're trying to do different things so that we can keep that school and home communication, you know, together, and to let them know that although they're virtual, that they're still a vibrant part of the Head Start program. The teachers make contact with those families on a regular basis. So it's been going really well. We were a little nervous about it, but the nervousness has gone. We're still looking at the statistics and the numbers in our area to make sure that everybody stays safe. But right now, we're holding our own, and it's been fun. Even in the midst of it all, it's been fun. Head Start is just a program that I always say, it's like if you were to stick your finger in the socket and starts to kick. That's what Head Start is to me. And that's what I want all of my staff, I want them to feel that, even our policy council, we're holding our own. So we just pray for each other. Thank you.
Thank you so much, Angela. And you have to celebrate the little victories,
Yes,
whatever they are. You have to celebrate the little victories, and they're in good hands there. So thank you so much for sharing that.
you're
The
welcome.
credit to our teachers and the things, the creativity they could come up with. last week was the Great American Shakeout Day, and the teachers actually did virtual earthquake drills with our children. And they took some pictures, and some of the kids they didn't go to like their kitchen table. They got in their parents' coffee tables and under the coffee tables, and the parents took pictures and sent them. And I'm going to tell you, that is just too cute to see a child trying to stick their head from under a coffee table to say that I'm doing my earthquake drill. And when I was looking at that, I thought that, out of everything, you can look at it as being the glass being half full or half empty. But with this, a lot of our parents sent comments. They didn't know that we did earthquake drills and that children would respond to these because they were just thinking, oh, my baby understands this. We teach them fire drills, stop, drop, and roll, how to have a safe somehow. And we do all these things, but those parents that are actively engaged and come in and out of the building, they get to see this. They look at the newsletters, they look at the curriculum, but some of the parents, this is really their first experience to really know what the teacher is doing sometimes in classroom. And yes, they're seeing it virtually, but they feel like, oh my God, my baby knows this. So the kids said, whenever something starts shaking, they know they have to get under the table. They have to get somewhere to get safe. So that did a lot to my heart to be able to be excited about last week, because they're not here, but all the requirements that we still have to have in place, we're doing the best we can. And I think the parents greatly appreciate that.
I would definitely echo that parents are really getting a better understanding of what you all do. Um, Teachers, family service workers, any support staff, administration, they're really getting a full picture of what everybody does and how it all connects together. And this is just allowing for you to build different relationships with particular families, those who might not have been as active as you stated. You really get to connect with them in a different way on a different level, because they're getting to see firsthand from a different lens. And so thank you so much, Joyce, for sharing that. Did anyone else?
This is Dawn, Spotsylvania.
Hey, how are you?
So I wanted to go back to Shaiki's question and agree with Kathy. We're on day 13 of children coming in person. We are doing hybrid small groups, so that's really wonderful. But the children are doing great with the mask. The mask is not a problem at all. And even the pods, they're staying in the pods. Now we have a couple yesterday that started with like, I'm taking my mask off and throwing it at you, but that's because of the comfort level. But we also know that those two children that did that, we know that they are capable of wearing the mask and being in their pod, because they showed us for 4 days. Now we just have to work with that. But also to also piggyback on Joyce, I think the teachers they've been very excited. It was something we didn't anticipate, was teaching parents how to teach. Moving away from workbooks and worksheets and like, here's how we teach. So that has been wonderful. The teachers are so excited, and it's like real time teaching them how to teach, which is really, really cool. And I just wanted to comment, I have a question for the group, but then also another thing with Dr. Bergeron, which is just, someday I'm just gonna have to write her an email. So if any of you did the readings, listen to her readings, oh my gosh, for the kissing hand, it's marvelous. She does such a good job. So in that reading, her cat's there, and her cat's name is Webster, and I have a cat named Webster. So to add that to my connection with a person I've never met, like, really, her cat is named Webster as mine. So my question to the group is, when we have brushed teeth in the classrooms, I have bought toothpaste with fluoride. When I'm going to replace toothpaste now to send home to children in their packages, are you buying, I know there's been some controversy the last couple of years about fluoride. So, but now that I'm sending it home and parents will read no fluoride or fluoride, what is the consensus of the group as far as purchasing toothpaste and putting it in packs to go home? Are you buying fluoride, or are you doing no fluoride?
Oh gosh, I don't know. I'd have to ask my health person. don't, but we have, we sent the packages home, but I'd have to check with them.
And I didn't really recognize it until I went to replenish it. And then, you can purchase it without and with, and then that's what drew to my attention. And I was like, all right, let me talk to Virginia Head Start and see. And I don't think that all of our children are on fluoridated water. Some probably are not.
In
But
Orange,
there is the controversy about fluoride a couple years ago, but I would love to see suggestions.
We did a drive-through health fair and family fall event on Tuesday, and
thank you.
Virginia Department of Health actually donated toothpaste for us to, and they knew they were sending it home, and it had fluoride in it, and it was a little oral health kit that they had with a checkbox, with a calendar so that the parents could check off where the children were brushing, the importance of brushing right after all meals, that sort of stuff. And it was a little packet, but it did come with fluoride. So
we're sending home fluoridated toothpaste too, because START requires that. They haven't addressed that we shouldn't, because one of our standards is still it needs to be fluoridated. That's why we send home fluoridated toothpaste.
It actually says in the standards that it has to be fluoride?
Yes.
Oh, okay. Well, yeah, if you could send me the standard, then I'm going to definitely go with the fluoride. I'm leaning towards that, but you always hear stuff in the news.
Right.
Okay.
Controversy has been there from the get-go, but I believe in fluoride.
Okay, I do too, but I just wanted to, now that they're going to actually see it.
Yeah.
Because when they're in the school brushing, the parents don't see the toothpaste.
Mhm.
Not
But
that we're
it
hiding
says
it. It's
that
just,
on- It says that on eClick, so I can get that link to you. It
Thank you. That would be
specifies
great.
about fluoride for the prevention of tooth decay.
Perfect. Thank you. There's my answer. Perfect. Thank you, Dorothea, as well. Yes.
No
You're
problem.
welcome.
Did anybody else have any updates that they would like to share how their program is going? Oh, great. Look in the chat box, Dawn. Jessica sent a link for you from eClick. This is so great. Everybody's working together. This is this is very essential at these times, to make these connections and just to talk and just to check in and see how everybody's doing and what's working for you and what have you heard in your area. What specifics are you adding to your policies and procedures? How effective are they? So this is great. Did anybody else have any updates that they would like to share? So Shaki did add in the chat that they received some kits from the Virginia Department of Health too. So check with your local department. You could probably save some money if they can forward some kits to you.
I have one question for the ones that are in operation. Have any of you had to deal with a staff member? Because we have a health protocol for our staff coming back. Have you had to deal with a teacher having to go into quarantine and bringing in a sub? How are you all handling that? Because we're still virtual, but even in virtual, we've had people to have to go into quarantine either from contact for a certain number of days, or before we opened, we had some to test positive that were cleared to be able to come back. But how do you do that when you have children there in the building?
Hi, this is Rosalind from the Capania Center. We actually had a couple of incidents, what you described. We have subs on a list, but we have monthly COVID testing. So those subs are required to take the test. If a teacher tests positive or was exposed, or she comes out of the classroom, and one of those subs go in.
Did anybody else have any contingency plan for in case you have situations where contact tracing or teachers testing positive?
Yeah, I was just gonna say we've had several instances where our teachers had to be quarantined because they were either being tested or was in close contact with someone that tested positive, and we still give them the option. In those situations, we give them the option to to telework, so they're still able to do their virtual sessions, or we break their class up into other classrooms so that the students can still get the virtual sessions. And so all of our virtual classrooms are on a pacing guide. So during any given week, they're teaching the same material. And we did that intentionally so that if we have to quarantine staff, the students can jump right in another class and still be familiar with whatever they're discussing for that week on the pacing guide.
If you went out beyond just the teachers, what about with family service staff? If you know, the confidentiality, the paperwork can't leave here. So how are you all handling, you know, because we have Child Plus trying to put data in, but you can't take the folders home. Anybody have any
We
solution?
actually gave them a lockbox, a locked carrying case, and they take the files home. But they signed them out. So we had a like a file transfer form, and they list the child's name and Child Plus ID number, and if they were taking the entire file or if it was health and they were just taking physicals and dental, that they were taking that. So they actually checked them out, and the supervisor kind of verifies that yes, it's the information that you're taking, and then they check it back in. So when they bring it back, it's kind of a check and balance to make sure that the documents or files that you took out, and they're not taking the original, they're taking a copy.
Okay.
So the original stays in the building, but we still want to make sure that you bring that copy back so we can make sure that that confidential information is disposed of properly. And they still have to keep it in the locked, so it's still locked in a transportable kind of file.
Oh, thank you so much. My poor brain is so limited. But I kept saying, you know, because I'm getting myself in situations where, you know, people, you know, some have family members that they have to care for, but I still need work done here. And that now I don't have a nurse. The nurse is transferred. All this data has still got to go in, and this just only so many hours in a day, you know, that you can do. But oh, thank you all. I like that. I got to tighten this up time we finished. Anybody else got some more good stuff out here?
Shaki, just really quickly, how many lock boxes do you have? Is that just specific to the family service workers?
It was just specific to the family service workers that were able to work virtually, and the health managers. But we kind of had them anyway because our family service staff travel from office to office, and like the master files are not located where the family advocates actually work at the centers. So they had them anyway just for local transport in the files. So if God forbid they was in a car accident and everything flew out their car, those files would still be secured in a locked file, transportable file cabinet. So we have them for our family service staff and our health managers.
Did you have at least one to be on site in case parents came in, or it was basically whatever you had according to whether schools were open, closed, or whatever?
Yeah, we had it anyway. We had it before COVID because they were transporting files.
Okay.
And that was the way for them to, you know, our way for them to securely transport files.
But see, we're only 11 square miles around, so one location, but
and we're across 5 cities.
Very good point.
In a huge bridge. So we had to make sure that, you know, those files were being, you know, transported securely.
Thank you.
And I'm sorry if you turned my camera off, but I'm rearranging my home office. My husband bought me a table yesterday, so I'm rearranging. So sorry for that.
That's all right. We're just making our way with what we have. Thank you so much for your input, Shaki.
Joyce, did you say that you do use Child Plus?
Yes, we use Child Plus.
Okay, because Child Plus they can access from their homes.
But see, they can access it from home, but you got to have the data to put in there.
Yeah, but I didn't know because we did the same thing as Shaki, sent copies. But we still had others on site, but I just wanted to make sure that you knew that Child Plus can be put on home computers or if they send something from the office as well.
We knew it was at home, but again, your brain can only go so many ways.
Because when they're quarantined, we're still expecting them to work unless they were sick.
Right,
They're
right.
sick, that's a different leave. But as far as just quarantine, then we are still expecting them to do the work from home.
And
And
see,
then they just cover for each other. The team does back there. They, you know.
and we have that policy here as far as our teachers. Every day we have to do a health screening throughout the division.
Yeah.
And so that we can monitor those things. But you do have some that may have pre-existing, and as we get closer to, again, I heard someone earlier say that the numbers are going up, but then they're talking more about bringing everybody back. But we just take it one day at a time. But you better have a plan in place, because if you fail to plan, it hits you right quick. So just in case we have to go with not, you know, if we open up and people can't come, how do you still get the work done? So this was worth me making sure I got in here this morning. That's good.
So
Well,
it's
that makes
similar,
me feel good. Thank you, Joyce.
definitely similar to last spring, because the buildings were closed down. And I think I was the only one in the building, and the bookkeeper part very short hours. And they did everything from home in last spring. They continued their services.
Well, they continued services, but because it was only one person in the trailer, one person in the library, so we didn't have but one people, and some of them felt it was only like a couple of weeks by the time we finished to get everything in. But now we don't know how long this is going to last, and I'm getting nervous about getting everything in, and this way I can say I'm comfortable with it. Thank you.
I would, because I have been open for a while, I would like, the only thing I would like to inject in this conversation is it's all over the map as far as COVID. It's we had someone thought they had allergies. Well, it turned out it was not allergies. I mean, they were working in hayfield, thought sure it was that. No temperature or anything. So really just taking the temperature almost gives you a false sense in a way. Actually, we probably had a couple that didn't even have a temperature. Being said, I mean, like I said, we've had our hiccups. We did close one classroom for a couple of days because a couple of people were sick and we didn't really have coverage, and we didn't really have a choice. Fortunately, those came back great. But it has, I mean, it's a challenge. It really is a challenge. And, but then I go in the classroom and I see the kids and I see what all is happening there. Then it makes me think, okay, we're doing what we need to be doing at the moment. Who knows what's going to happen in the next week or two or a couple of months, who knows, but I did want to inject that to just y'all be aware. We even send out an app. We have an app, and ours have to say, even if they have any of those symptoms, but I'm not at all those classrooms. So I don't know that they have the sniffles or this or that. So we really, as my ed person said, we had to come to Jesus meeting and said, listen, people, if there's anything wrong, do not show up at work. And since then, we've had a lot called in, and so we've just had to deal with it. So, yeah.
So our challenge has been parents. We have 2 positive parents. And then sometimes the school nurses don't want to contact them because of HIPAA, but we say, look, they reported to the teacher that they are positive, so we need, and then, the days of quarantine for the child. So that's been our challenge and then we also have the other, which sadly we have, well, I can't get you any papers because I have COVID, or I can't do this because I have COVID. And then they show up and we go, well, you can't be here if you have COVID. Well, I found the papers and I don't have COVID. So that's been but we do have 2 this week positive parents. And the child is being quarantined. But that's been a little touchy because the nurses are worried about just making a cold call like that when it's hearsay information. But they did finally, like, well, we can't be making the determinations. And we tell the parent, make sure you're in contact with the health department, but then they don't really tell us what they know about that. So that's been our challenge this week.
Well, we feeling challenges all across the board, you know, and just trying to just keep everybody safe, yourself, your staff, the children. You know, we all do this for a reason. So I applaud you and I say thank you on a daily basis, believe me, because I have to juggle in my mind full transparency about sending children back to school, but we're making these decisions virtually. And to me, you know, it makes it difficult because you know the children need to be there, you know that these are valuable experiences, but if it's unsafe for me, is it unsafe for them? You know, so we have to go back and forth with those decisions, and it's not easy. It's not easy at all. So you and your staff are putting yourselves in on the line on a daily basis, and I say thank you so much. So we're at 11:02. This was much appreciated for all of those that were able to participate. I hope everybody was able to have some positive and helpful information that they were able to take away from this. And once I receive the information, as I stated before, from Conchetta, I will forward that to you. But I do value your time, and I know that you guys are the rock stars for us right now, and I so appreciate you on so many different levels. So I will check in with you next week. Dawn should be back with us again next week. If you have any questions between now and then, please feel free to check in with me, send me an email, and thank you so much for joining us today. Have a good weekend and take care of yourselves and love your family. Bye-bye.
Bye, y'all. Be safe now.
Yes.